Hello, everyone. It's another day with a sleep specialist. I'm always excited to be your host, Ruth Ogogo. On behalf of Alps Hospitals, we love to say a very big thank you, our dear viewers. Thank you for liking our post. Thank you for sharing. Thank you for always following. Yes, you guys are doing so well. Today, we'll be talking about endometrial health and hysteroscopy. Yeah, so we have our star. When I say for someone watching for the first time, yeah, when you hear me say we have our star, you can guess right. It's Dr. Ken. Yeah, Dr. Ken, for someone watching for the first time, he's a consultant gynecologist. He's a minimal access surgeon. He's a fertility specialist and a very excellent IVF specialist. I must say, one of the best, if not the best. Oh yeah. So
And behave like Donald Trump's son.
oh yeah, so viewers, he has a lot to tell us
Yeah,
about
that.
the endometrial health and hysteroscopy. Yeah, that word, those words, or those, should I say, it's a phrase now, or whatever it is that you have to call it. He's going to tell us a lot about them today. So please call up someone, share this link with someone. Feel free to drop your thoughts, your comments, and your questions in the comment section, and we'll definitely attend to them appropriately. So back to you, our star for the day. Or is it just for today? No, it's not just for today, but
For,
let's
t-
just.
for today. Just for today, please.
Oh, yeah. Okay.
Oh,
So
yeah.
endometrial health, and then someone might be wondering what are they even referring to? Endometrial health. Is there what exactly are we talking about? So I don't know what that is really. So maybe you should tell us about it.
Yeah, it's a pleasure to be on the platform with you again. You're
Okay.
also the star for today.
Okay.
And more so, those listening are also stars for the day. Thanks
Yeah.
for us always following
Mm.
and learning one or two things from the wealth of knowledge we have to share. So I'm talking about endometrium.
Okay.
You know, as a gynecologist
Yeah.
first
Mm.
and a fertility specialist, an
Yeah.
IVF specialist,
Mm.
the part of the reproduction that I consider to be superior to all with respect to fertility is the endometrium.
Wow.
The reason why I'm saying this is I don't mind anything affecting other part of the reproductive system or organs,
Yeah.
but whatever affects the endometrium affects me directly.
Okay.
Yes, because
Wow.
it makes it difficult to
Mm.
achieve pregnancy. So if you
Wow.
have no ovaries or you have no eggs, it's all right,
Mm.
so long as you have the endometrium.
Okay.
Yes.
Mm.
So if the sperms are affected, it's still okay, so long as you have the endometrium.
Wow.
You understand? Um, if the endometrium is affected
Yes.
negatively,
Mm.
pregnancy becomes difficult even if you have good sperms,
Mm.
you have good eggs,
Wow.
and you have good uterine wall or
Wow.
something. All right.
Mm.
So I consider the endometrium to be the most important part
Mm.
of the female reproduction.
Wow. Mm.
Exactly. And then we see that there's a lot of, paucity of knowledge and
Mm.
understanding of what the endometrium represents in the cycle of reproduction.
Mm.
First of all, the endometrium is the innermost part
Okay.
of the womb,
Okay. Mm.
the innermost part of the uterus.
Mm.
Yeah, so if we classify the womb, if we divide the womb into three sections, for instance,
Yeah.
three units, you have the outermost part, which is the serosa. Then you have the muscle layer, which is the middle part.
Yeah.
Then you have the innermost layer,
Mm.
which is the endometrium. This is the place where menstruation flows from.
Okay. Mm.
This is where babies or embryos or zygotes get attached to.
Mm.
You know, so this is a place where when women go to have a termination of pregnancies, for instance,
Yeah.
the baby is evacuated from.
Wow.
So it is a very delicate tissue
Mm.
and delicate part of the female reproductive system,
Yeah.
that may be unforgiving
Hmm.
if it is not well handled.
Wow.
So when women complain that they have heavy menstrual bleed,
Yeah.
sometimes lasting for weeks
Hmm.
or maybe even for days, but heavier in flow,
Yeah.
it is because there is something affecting the endometrium.
Wow.
When women say that their menses is scanty,
Hmm.
their menstrual flow is scanty, it is because something may also be affecting the endometrium.
Hmm.
When women have D and C, for instance,
Yeah.
or evacuation of pregnancy,
Hmm.
and it wasn't properly done, and they stop seeing menstruation, it means that the endometrium has
Tampered with.
been overscraped,
Wow.
most likely,
Hmm.
and then it has been replaced by scar tissues, in which case menses doesn't flow again,
Hmm.
pregnancy gets difficult to happen, and all of that.
Hmm.
So when a woman have recurrent miscarriages, sometimes
Hmm.
there are a lot of causes of recurrent miscarriages, but an aspect that is often overlooked
Yeah.
is abnormality with the endometrium.
Hmm.
And sometimes even the infection that ladies have, they call toilet infections, like as you
Yeah.
hear a lot in Africa.
Hmm.
There's no toilet infections in our medical books, but in the medical books of the public,
Yeah.
there is toilet infection.
Infection.
Sometimes
Yeah.
this infection ascend from the vagina to the
Hmm.
cervix to the uterine cavity,
Wow.
and then affects the endometrium and scars the endometrium up.
Hmm.
You know, so endometrium is so important.
Wow.
So a whole lot of things can be interpreted to be coming from the endometrium. When a woman have a surgery, for instance, maybe fibroid surgeries, and
Yeah.
it takes too long, and maybe fibroids are lying on the lining of the womb and are enucleated or removed.
Yeah.
Sometimes scarring happens on the endometrium.
Hmm.
You know, and so endometrium is very important. So it
Wow.
is, in a nutshell, the innermost lining
Yeah.
of the womb of a
Hmm.
woman that has all kinds of effects
Wow.
on her health,
Hmm.
you know, and on reproduction.
Wow. So viewers, well, I don't I don't know what to say. Whether with this now, we're now maybe we should carry this endometrium like egg and just be extra careful for the professionals that might be watching these videos. Yeah, because for some of you that might actually even show this to your doctor, because sometimes your patients could actually show some videos to the doctor. They are seeing that, see
Exactly.
what I saw, maybe you should go through this to
That's
guide
true.
you in taking care of them. Yeah. So um there's just a lot about the endometrium that Dr. Ken is going to tell us more. So maybe you should tell us some of the abnormalities that could be associated with the endometrium based on your experience over time.
Yeah. Before I say that,
Yeah.
I want to still talk about how important this endometrium is to me.
Okay. This is a personal one.
It's a personal one to me.
Yeah.
Most times in arts hospitals, for instance,
Yeah.
we have lots of gynecologists working in herbs, you know. But I have a special sentiment, a personal sentiment to the endometrium, the lining of the womb, so that if or when I'm not the one operating, and I know that this patient is going to end up on my fertility table,
Yeah.
I make sure I go into the operation table. I mean, operating room, and I watch the surgery because I want to be able to interpret what you do to the endometrium. I know sometimes you can be so fast with your surgery and not minding because you're not a fertility specialist,
Just breach.
and you just cut through everything and you want to. When it's getting through the endometrium, I shout at the surgeon. I know, not shouting out of disrespect or because he doesn't know what he's doing, because I feel like you're cutting me. When you cut the endometrium, it's like you're cutting my, because I know
Wow.
you're going to leave a scar on
Yeah.
that endometrium. So whenever I show up in the operating room, and the fibroid surgery is going on. They say, Ken is around. I say, guy, you better not touch the endometrium, because
Oh
this woman is going
yeah.
to get pregnant.
So it doesn't reduce her
The reason is this, you
prospects.
see, a lot of women have fibroid surgeries
Yeah.
done by all kinds of people.
True.
And then the endometrium is scarred. And so you hear women saying that we had fibroid surgery, we didn't get pregnant anymore.
Oh
Just
no.
wondering what's happening. Sometimes it is the endometrium that has been affected. But some fibroids are very notorious, actually. They just sit all around the endometrium. And so it's difficult to take them out without breaching the endometrium. Sometimes it's inevitable breaching the endometrium.
Wow.
But when you breach it, you should have a special way of repairing it.
True.
And also take very precautionary measures to prevent scarring from happening. So when it's breached and I see it, okay, now guy, we've breached the endometrium, so we're going to fix it, So fixing it, you treat it and make sure it heals properly. Because for a woman who has not gotten babies yet, it may be a problem for another day. So that is how personal the endometrium. It's so bad that if a woman had a miscarriage, for instance, and then the regular surgeons or the regular gynecologists do evacuation of the product of conception, I don't like people doing that for me, because I feel you're going to uh, to affect it negatively.
Wow.
The reason is this: evacuation of product of conception, which is MVA, it's a bad procedure. Yes, I'm saying it. It's a bad procedure. Because sometimes, these embryos in the early stage, they just appear like dots. The entire uterine lining, endometrial lining, surface area, let's assume it's about 20 millimeters squared. Assumption. This is not it. It's a very tiny space.
Wow.
The uterine lining is a very tiny space that when the uterus is empty, it may not take two of these fingers.
Wow.
When the uterus is empty, it may not take these two. So that's how small it is. And then the pregnancy implants on like 5 millimeters diameter of the entire uterus. Then when it starts growing, it grows gradually to occupy close to half of the uterus, then before development starts. Now, early stages of pregnancy, it implants just about 5 millimeters and then it grows from there, less than 5 millimeters at implantation, as a matter of fact. Then she has a miscarriage for one reason or the other, and you want to evacuate it. Do you know what happens? The technique of evacuating it is to evacuate everything. So you're scraping off the 5 millimeters, for instance, where the implantation happens, and then you are at the same time scraping off all the other free areas where implantation doesn't happen. So you create injury on the lining of the womb. And so sometimes after this evacuation, no matter how gentle it is done, you still leave the woman with scar. And you will not be surprised when she finds it difficult to get pregnant next time. But this is not to say that it doesn't work. The procedure, you could still do it and it works, and women get pregnant often and often after that. But a small percentage of women may not do well after that because of how inflammation and scarring occurs. And then this evacuation has actually been outlawed in modern medicine, in modern gynecology. I think 2 years ago in Malaga, Spain, it was recommended that evacuation should be done under hysteroscopic guide. That's to say, you put a scope inside the uterine cavity, and then you only scrape off, and the word is not even scrape, you shelve off. This only the place where the pregnancy is attached. So you leave the other places healthy and free. So this is precision evacuation. So, and then D&C has been outlawed. It's an unhealthy procedure and has not been modified since the 1800 something, where it was initiated in France. It is one procedure in medicine that has not seen development. So the health of the endometrium is very healthy. I mean, it's very important. So I
Yeah.
actually don't like to see that done. And you know, the way we were taught when we were in the medical school or early years in the residency, he said you just keep scraping.
Screen. Oh
It's
my
like you put a
goodness.
cannula into the uterine
Oh no
cavity,
no
and
no.
then you just be making around, circular movement
Oh wow.
and back and front movement
Mm.
to ensure you scrape the entire wall of the endometrium.
Wow.
So you're pouring out, it's just like you're pouring out the baby and the bath water.
Yeah
Everything you
yeah.
discard. So you're scraping where the implantation happens and where you
Wow.
don't have implantation.
Mm.
How barbaric could that be? But
Yeah.
that is what evacuation
Wow.
of retained product is. So it is one procedure in Africa, for instance,
Mm.
that affects the uterine health and affects chances of getting pregnant. So I'm very scared of that procedure. And I don't like people doing it for my own patients.
Wow.
So, but then I guess with time in this sub-Saharan region of the world, we
Yeah.
will get to a point where all facilities will have hysteroscopy and early pregnancy losses can be treated by evacuation under
Serious.
hysteroscopic guide.
Wow.
That is the best practice
Mm.
right now. So I'm saying this is how endometrium affects me
Mm.
because I have to explain to any woman why she doesn't get pregnant
Mm. Yeah.
if I do an IVF treatment for her.
Yeah.
So fibroid surgeries, evacuation of pregnancy could have a
Yeah.
negative effect. But
Mm.
that doesn't mean that if you have evacuation, you will not get pregnant. You could,
Mm.
but for some few persons, they may find it difficult getting pregnant. So I've taken a lot of time without answering your question. What was your question again?
Abnormalities.
Aha.
Also, yeah, I just gave. So, Dr. Ken. So today, Dr. Ken is also an endometrial specialist. Now you can see the passion coming from him as he's actually trying to explain
Yeah,
the endometrium.
it's so bad. Sorry, I'm having a lot of personal conflict with this topic.
Yeah.
It's so bad that even the energy you use in operating in the endometrial cavity should be refined. For instance, we have the bipolar forceps
Yeah.
or resectoscope or knives that we use in operating in the uterine cavity.
Yeah.
Now these bipolars or monopolars, when they cut in the uterine cavity, for instance, if a woman have a fibroid in the
Yeah.
uterine cavity, like the fibroid we call grade 0 fibroid or grade
Okay.
1 or grade 2,
Okay.
when you operate, the energy spreads.
Mm.
If you're cutting in a line, for instance, it spread 5 millimeters. Some of them spread 5 millimeters to one side and 5 millimeters to the other side. And so you burn and damage areas that are not intended. But you're not doing it intentionally, but that's what the energy has to offer.
Wow.
So for us, reproductive surgeons, for instance, intrauterine surgeons, we prefer to use energy that doesn't have a spread.
Wow.
All of this to reduce damage to the endometrial cavity. So if a woman meets me, for instance, and says she has a surgery, intrauterine surgeon, I ask her what kind of energy was used
Used. Mm.
because I want to know what to expect of the health of our endometrium.
Mm.
Because sometimes you do a very beautiful surgery, but because you don't have a refined energy, you cause a lot more damage. And of all of these, the laser is the safest, the diode laser, because when it cuts, it stimulates the myocytes
Oh
and cause
wow.
healing on the myocytes. And
Okay.
then the spread is basically like 1 millimeter on each side.
Wow.
So
Wow.
it has less negative effect
Mm.
on the endometrium. So when you talk about endometrial health, what comes to mind for me is very advanced and can be very complicated. And I can only talk about this in a high level, subspecialized a gathering. But for the sake of the public, if you want to have a surgery, for instance, in the uterine cavity, it's good to ask what kind of energy,
Mm.
what kind of energy are you
They
using?
dissipating.
Because sometimes it's even better to use a cold energy
Mm.
if the electrical energy could cause more damage
Damage.
for a woman. But then you have to select which kind of woman. If a woman has finished having kids, of course you can go to town with any energy you have available. But if she's still considering pregnancy, you need to operate her with the intention of leaving her with possibilities of getting
Conception.
pregnant easily.
Mm.
So this comes to me very personal, and that is why we in ARPS invest a lot in very refined kind of energy. And if you're coming to do fertility treatment, for
Yeah.
instance, we make sure that any form of energy we're using to operate you leaves you with healthy fertility potential, you know. Because, for instance, there are some energy, let me digress a little. You use on the ovaries because you want to stop some bleeding, you kill part of the ovaries and reduce the potential to produce eggs.
Yes. Wow.
You understand? But because it does the work doesn't mean you're better off after the work
Yeah.
is done.
Mm.
So yeah, but back to the endometrium. There are a lot of abnormalities that can be with the endometrium.
Okay.
You know, the endometrium could be it could be growth
Okay.
on the endometrium, and these growths can be in the form of polyps.
Okay.
Polyps are like soft tissue growths.
Okay.
Sometimes they look like overgrown endometrium itself.
Mm.
And then fibroids can be inside the uterine cavity
Wow.
or pushing into the uterine cavities, you know. Then you could have scarring, adhesions, like you have an injury and
Yeah.
then it heals and leaves a scar.
Scar.
These
Yeah.
scars form everywhere,
Mm.
including the uterine cavity,
Wow.
you know. You could have infection and
Okay.
inflammation in the
Okay.
uterine cavity. That that there's some infection like chronic inflammatory conditions of the endometrium, that you have a lot of micro polyps,
Mm.
you know, and then you don't see this easily on ultrasound scan. Even if you do the famous 3D ultrasound scan, it's difficult to appreciate endometrial chronic endometritis,
Mm.
you know, and then hysteroscopies may show you all of this. And then all of this affects the way a woman bleeds,
Mm.
the way she conceives, and how long she carries a pregnancy. I mean, from
Wow.
the early stage, and sometimes the uterus can just be, the endometrium can just be non-viable. The normal endometrium changes with colors depending on the time of the cycle.
Yeah.
It could be pink at some point, then it could be light pink at some other point.
Okay.
And when the lining is overgrown, it may look a little whitish
Okay.
and all of that. But then some just look dusky white.
Mm.
And then it means they are bad already, even then there is no growth.
Wow.
So something has happened. Endometrium has been devitalized.
Yeah.
So these are some of the abnormalities that can happen with the endometrium. You know.
So, viewers, there's just a lot about this endometrium. As small as it is, it seems to be like the biggest power of house for the woman. Yeah, just because, yeah, you could actually conceive without your egg. I mean, if there's a sperm, once there's an endometrium that is healthy. So, you see that it's so vital. And yeah, need I also let your dear viewers know we're talking about endometrial health and hysteroscopy. It might interest you to know that Dr. Ken was the first African to have commenced laser hysteroscopy. So you can imagine so much knowledge existing in him and in Alps Hospital, because this knowledge has also been extended to the gynecologists in the house. So you just have a lot that you would actually get from this. And for someone that might be needing this, you have a lot to gain if you get to have a hysteroscopy in Alps hospitals. So yeah, back to
And you should
endometrial
say it.
health.
I was trained by the best in the world.
Oh yeah. So you see, there's just a lot. So you see why I say he's a star. We're just not far from it at all.
Oh yeah.
Okay, yeah. So now we're talking about endometrial health and hysteroscopy, and you've talked about abnormalities. What are some of the ways that hysteroscopy could improve the endometrial health of a woman?
Oh yeah. Let me start by the latest thing that happened to me,
Okay.
and that's within this week. I had seen a woman, towards the tail end of her reproductive life as a woman.
Okay.
She had had a condition with the uterus and she was bleeding. Very, very terrible bleeding. She just had like blood transfusions because her menstruation was very heavy.
Wow.
And then she's been seen in quite a number of places. And the best they could see were small fibroids, not in the uterine lining now, from their evaluations, not on the uterine lining. And they were in the myometrium, what we call intramural fibroid, but
Wow.
they're so small, like 1 to 2 centimeters. And this fibroid could technically not explain
The
the
bleeding.
volume of bleeding she had. This massive bleed to the point of having up to 2 to 3 units of blood
Blood. Wow.
transfused, and then the uterus wasn't even big, and then when we evaluated, we saw a focal adenomyosis, and yet with the
Wow.
focal adenomyosis, you shouldn't have that amount of bleeding.
Bleeding.
And then she was offered surgery, so she just came to us for a second opinion. All right, we still offered the surgery because she's done with her fertility life. She had all her kids already, but she was so scared of having the surgery. But somebody told her that we do laser surgeries,
Okay.
laser gynecological surgeries. And
Yeah.
then we thought, okay, she opted for medical management.
Okay.
I said, well, if I will offer you medical management, I would like to do a hysteroscopy to see what exactly
What's
we may
going
be
on there?
overlooking that may be causing this bleeding. Then one of the gynecologists in APS, of course, took her in for hysteroscopies. It wasn't
Yeah.
me. So right there, you saw this fibroid that was looking
Okay.
a bit big in the uterine cavity.
Wow.
So this is an intracavitary fibroid.
Hmm.
For some weird reason, it wasn't picked up on ultrasound scan. Of course, question the
Wow.
competence of the person who does the ultrasound scan,
Yeah.
because some of these endometrial lesions sometimes may be difficult to see by ultrasound scan. So with hysteroscopy, you saw that immediately because you have vision in HD. So it was clear. And of course, when we saw it, I was very happy, not because she had it, but because we could now explain
What bleeding?
why she had heavy bleeding, because all the other things seen on the uterus were not enough to explain
The kind
that
of bleeding
massive
she was
bleeding
having.
that could make her go weak, fainting, and having blood transfusion. Well,
Wow.
and immediately we used the energy sources and we took out the fibroid just within a minute or
Wow.
so. And then, of course, her eyes were open. So she saw it and she appreciated it. So sometimes these abnormalities in the uterine cavity may not be seen by some modalities of investigation, except with hysteroscopy. And even when you see by some other modalities, they may just be as at best shadows that
Yeah.
need experts interpretation.
Interpretation.
But with hysteroscopy, even a blind person,
See it very
in
clearly.
quotes,
Yeah.
would see what it is and be able to take the appropriate steps to correcting that. So you could imagine this woman is going in for pregnancy related care.
Yeah.
So that means that any woman having heavy menses sometimes should have a hysteroscopy before going in for a fertility related treatment,
Treatment.
because during hysteroscopy, the problems, if at all there are,
Yeah.
would be seen and the appropriate intervention could be
Be
given.
done.
So fibroid could be seen by hysteroscopy,
Okay.
and sometimes polyps
Wow.
may be seen, and polyps could also cause heavy bleeding. That could sometimes want to take the life of a woman. And then when you have women occasionally who are already close to menopause,
Yeah.
or even who are already menopausal, whose menses have stopped flowing,
Yeah.
coming with bleeding, or spotting.
Yeah.
Sometimes you need to see what is causing that. If you look at the cervix and the cervix is looking healthy, you may need to put in a scope, a hysteroscope into the uterine cavity.
Yeah.
Sometimes you may see lots of polyps.
Wow.
And for an advanced age woman, when you see polyp, you take them out by hysteroscopy. Sometimes when you don't know what diagnosis is, you want to use a very big intervention for a very small problem.
Problem.
Polyps are small, but they can have big effects.
Yeah.
But if you have a right investigative
Gadgets.
devices
Yeah.
or gadgets, you could just do a polypectomy. Just remove it instead of removing the uterus entirely. Because for
Yeah.
some weird reason, African women don't like their uterus being removed because they feel that in their
There are less
return,
of you.
when they are reincarnated, they'll come without uterus.
Interest.
That's a myth, for the
Oh
African women.
yeah.
So they don't want it removed. So they like very minimally invasive procedure. So with hysteroscopy, you could see a lot of polyps. You take them out.
Wow.
You could see fibroids, different categories of fibroid,
Yeah.
and then you don't have to open up to do those surgery. You don't have to do an
Wow.
open
Oh,
surgery.
really?
So you could use your hysteroscope to
Okay.
take out the fibroid. And the energy devices you use depends on the stage of fertility of the woman. So you use a befitting energy source to help, And sometimes the beauty with the laser, for instance, even if you don't want to cut off the fibroid, you could use the laser and devitalize the fibroid.
Oh, really?
Yes,
Wow.
and then the fibroid shrinks gradually
Okay.
to the point that the symptoms would become minimal or
Okay.
gone. Then
Wow.
you could use the fibroid to I don't want to use the word vaporize because it makes it look like boiling and disappearing. It
Yeah.
myolizes the fibroid, and then the symptoms also reduce. So
Okay.
the laser is just a very versatile tool. And for me, I think I'm addicted because from the moment that I got inducted to the
Yeah.
International School of Laser Gynecology, I
Gynecology.
found out that my go-to device seems to be the laser, because it's very versatile. It can do all kinds of things, you know. So it myolizes it, it cuts it off,
Wow.
it shrinks it, and it's less complicated
Yeah.
and it's easy to apply if you're trained. So use the right energy devices, and all of that to address that. Then for women going in for pregnancy related care,
Yeah.
if you've had recurrent pregnancy, failed miscarriages,
Yeah.
it's good to look at the lining of the womb to be sure it is in order before you go in with your subsequent treatment. Sometimes you could see scarring. Maybe a woman has had fibroid surgery, or we even see women who have had cesarean delivery, cesarean sections, and then depending on the kind of practice of cesarean sections operations, some people feel after a woman had a cesarean section, they clean out the uterine cavity. And then you ask yourself, why do they clean that? If everything is out, why do you have to clean it out? So, and they clean with so much power. And when you clean it, the uterus at that point is friable. You clean injuries into the lining of the womb, and then eventually it heals. If it's not infected, it may heal with scarring. So you see people just having just ordinary cesarean section, and they come with endometrial scars.
Yeah.
So a hysteroscope would help reveal,
All of
and
that.
then you could help solve some of the problems.
So there's just a lot that hysteroscopy could do to actually improve a woman's endometrial health. So we have a question for you, Dr. Ken.
Yeah.
So Prince Will Somi, she said she has done hysteroscopy 3 times. Wow. And did IVF last year, but it failed. She's going for the second.
Then now she's having 3 millimeters or 3.5.
6.5.
Okay, 6.5.
It's not going beyond that.
It's not going beyond. So it means that it is a problematic uterine cavity. We don't know what kind of gadgets they was used to do hysteroscopy. But bottom line is that something has affected negatively the IVFs. There are no next one is going to work.
Three hysteroscopies, but she did one
Okay, one IVF,
so she could also
she could, but chances of succeeding in this case is a little bit low because already you know it that this endometrium has a problem. That's the reason why 3 hysteroscopies were done in the first place. Now we have similar patients like that, and sometimes you do hysteroscopy once and tell them that we're going to need a second loop hysteroscopy because the problems there are very massive. I mean, big problem. You cut the scars, you stop at some point so you don't cause damage. So you want to repeat it some other time. And some people have it up to 3 times. But it is not the number of hysteroscopy that is a problem, it's the pathology in the lining of the womb that is the problem. So if it continues like this, things that may be done in this case is hysteroscopy with installation of platelet-rich plasma to regrow the endometrium. You understand? Yes. I have a very interesting boss in Bulgaria, for instance. And then, for me, he is my hero in history, in hysteroscopy. He's the baddest. I mean, when you say the bad guy's hysteroscopy, you just need to see him. He understands hysteroscopy as if he understands endometrium as if he created the endometrium. I admire working with him a lot. We have some cases like this in Europe, for instance, that we take out the entire endometrium.
Okay.
Yes.
Wow.
And we grow them patiently. And we do the treatment and they got pregnant.
Wow.
These are award-winning procedures. How he does this is just mystery to me, but I'm glad he's my teacher, or he is my teacher, and I can't but admire working with him. So some cases like this, you may want to do all of those. And of course, if it becomes too traumatic to bear, then what do you call this? Surrogacy may be a good option here because I don't like how that history sounds, sorry. But we love the question, but we have to be frank with you. We can't give unnecessary hope because we are scientists. Our hopes are based on evidence, but all hopes are not lost. With bad endometrium, sometimes people get pregnant. But even when they get pregnant, I don't rejoice. Because if the endometrium is bad, you will get pregnant, but you have miscarriage soon after. So we're only happy when you deliver the baby at the right time. So you need good reviews, and you need to be managed in places where the knowledge the knowledge of uterine lining is adequately available.
So like Dr. Ken has said, maybe you could take your chance with second one since you're already at it. We hope you succeed. If it happens, we'll be happy for you. But if not, maybe you could seek more help from the APS team and hope that.
In fact, we have now that we're talking of fertility care, among the experts in hysteroscopy, they feel, or we feel, that every woman having challenges with pregnancy should have hysteroscopy as a compulsory thing to do. But now you can't make it compulsory because it depends on the setting under which she's having this care. If it's an insurance setting, you must have a justifiable reason to do the hysteroscopy. But if it's a private setting, it's okay to do it. Even if it's a normal hysteroscopy, at least you've understood something about the patient or the client. So you know that endometrium is not likely going to be the problem that will bring the challenges for her. So the unspoken recommendation is have hysteroscopy. Because the way we see endometrium, it needs to be different.
That's why sometimes you hear so. I think that maybe you have had experiences of people that they said they did hysteroscopy and they said it was fine. And then by the time
no, let's talk about that. Most times, they do hysteroscopies elsewhere and they say it's normal. I say, really normal? And from just basic ultrasound scan, I see that there are problems and you have to tell me it's normal. So we request that we want to do. Then after a lot of argument, you go there. And it's so bad that even the attendant in the operating room in ARPS knows abnormal lining of the womb.
Wow.
Oh yes, it's that bad. And they were like, oh, Ken, there's a problem here. Ken, there's a problem here. So, Ken is just teaching you all this. So they know the pathology very clearly. So, one, interventional surgeons or hysteroscopic surgeons should understand the atlas, the anatomy of the endometrium to know what normal is and what abnormal. And then we should also be able to prognosticate what the chances are after doing hysteroscopy, because hysteroscopy doesn't make everything normal. It doesn't make everything normal. It just gives an intervention, and nobody says after hysteroscopy everything is going to be fine with you, because already there's a problem. The problem can just be improved on. So you could have hysteroscopy and still have a failure. So you need to understand what hysteroscopy offers, what it means, and what can be done. So these are all it's now.
Okay, so we have one last question before we wrap up. This person asks, can I ever be successful with endometriosis condition? Yeah, we have a lot of questions coming up, but and then this one is asking, what should the normal size of the endometrium be to be successful in pregnancy or IVF? So the other one is talking about endometriosis, and the other one is asking for the normal size.
Yeah, the size of endometrium is very interesting. The normal size is any size in thickness above 7 is good, but beyond 14, you're beginning to be worried too. Even though we've had patients that we were worried and written off because they've gotten up to 20 millimeters endometrium and they got pregnant, and we say these are just outliers. Hysteroscopy shows that the lining was fine, no problem, but it's just thick. We just have to understand that there are individual differences. But the regular thickness of the endometrium is just anything beyond 7 to 14. So those having endometriosis, I want to relate it to the hysteroscopy, for instance. Endometriosis affects the lining of the womb. It makes it hypervascular. It increases the vascularity of the uterine lining and can affect implantation because of the chemical it elaborates when you have endometriosis. So all kinds of treatment that needs to be done for endometriosis should be done before the woman embark on fertility care. And sometimes you could have adenomyosis, which is also like an endometriosis, but this time located around the lining of the womb. And still kudos to my trainer, Professor Staminov, and Professor Haimovich. When you do hysteroscopy, for instance, and you see black spots that look like dimples just around the endometrium, sometimes it will be an adenomyotic lake. Then you can puncture it, and then you see black effluent, which is like chocolate cyst fluid. So it depends on how exposed you are and how much you know about pathology in uterine lining for you to be able to interpret all of those. So endometriosis affect the uterine lining. Adenomyosis affect the uterine lining, but you need to be able to make your diagnosis and treat them before pregnancy is done.
Okay, so for this person that asked the question, hope that answers the question. Yes, you could be able to have a successful IVF depending on your choice and the degree of endometriosis. So keep your questions coming in, dear viewers. We will keep attending to them. We have very private chats. You could also send your questions to the WhatsApp line being displayed. This is the much we'll be able to take for today. Thank you so much, Dr. Ken.
I'm not done yet. I'm not done yet. I'm not done. Don't thank me yet. Yes, this endometrium for me, as I said earlier, is the most healthy part of the human reproductive system. So my advice to all women is do everything to protect this endometrium. If you have disease condition, treat it as aggressive as possible, because disease like pelvic inflammatory disease or vaginal infection that are sent up to the uterine cavity can affect. So treat with the right gynecology. Then if you observe that your bleeding is abnormal, also see a gynecologist. Part of the thing that needs to be done. Most gynecologists don't think that excessive bleeding, even when fertility is not in question, requires hysteroscopy. So in fact, there's a lady from the United States that gives a lecture in all of our garden whenever she is invited.
Okay.
The lecture she always gives is she's from Virginia, United States. Is that uh, as a gynecology,
Yeah.
we don't go stethoscope most of the time. We are special. A stethoscope is in our digits, but they say we should have hysteroscopy. Our hysteroscopy is our stethoscope because the woman's menstrual cycle tells you a lot about her. The one of the lecturers that I have from Oxford is the beginning of problems
Wow.
because if it is anti, it's problem. Heavy, it's problem. If it stops flowing, it's problem. So you need to have a time and use it in your hand to solve the problem. So feel free to accept hysteroscopic intervention when it is offered. It may not pick up an abnormality, but it's good to know there is no abnormality. Because whether it's negative finding or positive finding, it is still a positive procedure. So now I can end. Thank you very much.
Oh yes, so I have a comment. Someone says the endometrium is small but mighty.
Oh yes, I love that. I think that I should adopt that statement. It may be small but mighty. You see it pulling down very mighty women. Yes, a woman just have problem, complain, just menses. Menstruating for 1 month, menstruating for 2 weeks. How are you supposed to put your life together? So yeah.
Okay.
Small but mighty.
Okay, maybe I should give this accolade that Justina is saying. She said her guru doing what he knows best. God bless you and the able upstairs. Oh yeah, thank you, Justina. so we'll be ending on this note. Thank you, dear viewers, for staying tuned. It was good to have you as always. Thank you once again for staying tuned. Until we come your way next time, have a good evening.